Hello everyone. In today's presentation, I'm going to discuss the vital role of language workers in Moroccan hospital, and especially when it comes to serving the indigenous people of that area. So Morocco is a small country that is located in the North Africa. It is bordered by Algeria to the east, Mauritania to the south, Mediterranean Ocean to the north, and Atlantic Ocean to the west. So Moroccan people are known by their ability to speak multiple languages. This is due to their history. Morocco has historically endured multiple conquests by several nations. So the first settlers of Morocco, they were called Berber. Those people, they came from multiple tribes of Africa and they decided to settle in that area. After their settlements, they were invaded by the Arab people in the 7th century, followed by the French people and then the Spanish. Currently, the dominant language in Morocco, it differs from the area that you're going to visit. So it is considered that all 5 languages are the dominant, but they differ depending on the places. So we have in the north area of Morocco, in the south area, the 2 dominant languages are Darija plus Spanish language. And then we have in the middle area of Morocco, the dominant languages in there, it's a French and Darija. So in case you're asking what is Darija is, it's basically a mix of all these languages together. They mix the vocabulary using the Arabic language structure. So you're gonna find if you know all these languages and you hear a sentence from a Darija, you're gonna notice that there is an Arabic sentence that is filled with vocabulary or terms that are derived from French, Spanish, and Amazigh language. So basically, Darija is the dominant language in the whole country. So as I mentioned before that, if you want to know what is the dominant language of Moroccan society, you need to know which area you're going to. So if you're going to visit the urban area, you're going to find the Darija, of course, in Spanish or the French language that are equally dominant. And of course, you're going to find some of the Amazigh language here and there. And also we have the rural area. The rural area, it is also divided in 2 different places. We have the places that is lived by exclusively Arab people, where they use only their Arabic language or Darija language, and we have the rural area where the indigenous people live and where they use their own language, they follow their own they practice their own tradition and norms. So today, or in this presentation, I'm going to be focusing on the area where the Amazigh people live, and if they wanted to go visit Moroccan hospital, what kind of struggle they're facing, and what kind of solution they have to fix those problems. So the Berber are the indigenous people of Africa. They were called so by the Latin king because when he heard them talking, all he was able to hear was Berber. So he decided to call them barbarous. It's a Latin term that means barbarian. So the indigenous people of Morocco, they refuse to be called that term, and they come up with a term that describes them the most, which is Amazigh. Amazigh in the Berber language means free people. So Amazigh inhabited Morocco around 10,000 before Christ with a population of 40 million. 40 million person, and most of them, they live in Morocco, Algeria, Libya, Tunisia, and until the Siwa area of Egypt. They have their own year calendar, which is as of the January 2025, it's 2975. The majority of them are Muslims, and they practice their tradition in the norms, and they incorporate it with the Islamic belief. So they're basically Muslims. So the indigenous people of Morocco are divided into three different tribes. Each one has its own tradition, language, and beliefs. And they are located in three different areas. So we have the Tashlihit dialect, that is in a pink color, and then we have the Amazigh in a green color, and lastly we have the Tarifit in the orange color. So today I will be focusing on the Atlas Mountain area, where it covers the Tashlihit and Tamazight dialects. Since this presentation is about the languages used in Moroccan hospitals and how the indigenous people are struggling interacting with the faculty members and the hospitals members due to their language barriers, I thought it is important to talk a little bit about the dominant language in Moroccan medical schools. So in medical schools, the primary language for instruction is French language. The teaching process for students is divided into two different phases. We have the preclinical phase where the students sit on class and read everything and learn everything from the textbook and the teacher using the French language. And then we have the clinical phase where the students need to go to the hospitals and rotate in different specialties to do hands-on experience and to communicate with both the patients and the faculty members with the French language. So since the doctor's education was mainly done in the French language, hospitals they use French language to facilitate the provider's job. So all the forms that they will provide you in the hospital are written in a French language, including your consent form, your radiology report, immunization record, progress note, even your prescriptions. If you don't speak French language, you're not going to be able to know what's in those forms. And also the dominant language in hospitals is French language. So doctors and nurses, they will interact with each other in French language. And if you don't understand the French language, providers can explain to you what's going on with your case in Arabic language. He will tell you what's going on and what kind of treatment he will be doing. However, when it comes to medical terms, like any medical terms, he will not be able to tell you what's the equivalence of this term in Arabic because he doesn't know it. And because of all his education was done in French language, so he will only tell you what's that in French and explain to you what's the meaning of that term in Arabic to be on the same page as him. For example, if you're suffering from fibromyalgia, he will not be able to tell you what's fibromyalgia in Arabic. However, he can explain to you what is the symptoms and what kind of treatment he will be doing. But he doesn't. You will go out of the exam room without knowing the name of the disease that you're having. You just know the side effects or like symptoms that you're having. And also the tests that he will be doing, all of them are in French language, so he will conduct the necessary tests without telling you the name of these tests because he doesn't know them. And you have to trust the provider on that and let him do his job, even though you're not you don't fully understand what kind of treatments you're gonna be having. In the previous slide, I have covered the issues and the problem that an Arab patient faces when he wanted to be seen in Moroccan hospital and he doesn't speak the dominant language or the French language used in the hospital. Imagine the struggle and the problems that an indigenous patient faces when he wanted to be seen in Moroccan hospitals and he doesn't speak neither French nor Arabic languages. Because Moroccan hospitals do not provide any kind of interpreting or translating services, it is the patient's responsibility to bring a non-professional interpreter with them to help them interact with the provider. So using a non-professional interpreter will definitely impact the outcome of the visit. In the figure, show us the way the conversations should flow in the existence or with the usage of the interpreter. We have the health professional, interpreter, and the patient. The conversation should go in a triangle way. After the provider finishes his utterance, the interpreter should convert it using the patient's language. And then when the patient hears it and respond to it, the interpreters need to convert the patient's response using the provider language. So it goes in that triangle way, so everyone in the room is on the same page and everyone is being heard and understood at the same time. Unfortunately, with the usage of non-professional interpreter who doesn't have any previous training in the interpreting field, the flow of the conversation does not go that way. So basically, the flow of the conversation goes between the healthcare provider and the family member, which is the non-professional interpreter. And the patient is basically left out of the conversation until the two of them finishes their conversation. And if in case they have any concerns or the provider have some kind of questions that the non-professional interpreter cannot answer, then they will stop the conversation. The non-professional interpreter or the family member will ask the patient about that particular point, and then once he gets the response to it, he will explain that to the provider. But basically, the patient is not involved in the conversation. This will basically lead to a very catastrophic outcome, including misunderstanding between all parties of the conversation. The patient is never involved in his own healthcare decision-making process, and he's not aware of anything at all. So he's kind of left excluded out of the conversation. It's like the whole visit, it's not about him. This has all happened because the non-professional interpreter does not have any kind of interpreting training. He does not know what is the importance of language justice, how to implement it within the room, how to explain all the concerns and the problems of the patient to the providers, and how it is important that ensuring comprehension between all parties of the conversation is very vital in the decision making that the provider will make in healthcare treatment that he will choose for that particular patient. And the last thing we have that, of course, the non-professional interpreter will not adhere to ethical code of ethic or ethical standard because he's not aware of any of them. The patient cannot identify if there is any mistreatment by the provider, and the patient will not be able to know if he is going to be treated equally as other patients who speak the dominant language of the area, if he deserves the kind of treatment that the provider picks for him, or even have the rights to speak up and discuss the main complaint that he might have. So we cannot deny that using a non-professional interpreter can help, sometimes can help getting more information with the patient, especially if there is huge bond between the patient and the family member. They can help the provider get more information or necessary information to have like a clear picture about what's going on with the patient. They can be there for the patient to provide some kind of emotional or support or comfort. They also can help the provider understand some kind of cultural related issues and explain to them the reason that they're doing some kind of particular gestures or follow some kind of lifestyles due to their cultural attachments. They can also facilitate, sometimes they can facilitate speech, even though it's not perfect, but at least the provider will have an idea about what's going on with the patient and what is the perfect way to handle his problem or to handle his health condition. Using a non-professional interpreter to help patients interact with providers is never enough and will never give us the desirable outcome that we're looking for. This is why it is best to hire language workers or interpreters to complete the task in a very professional ways. Basically, language workers serves as a link between the provider and the patient. He makes sure that the patient is getting the necessary services that best fit his conditions or healthcare needs. He also ensures that the implementation of language justice is happening within that particular place, which means that everyone within that room is able to speak, understand, and be understood using their own preferred language without being afraid of being misunderstood or misjudged because of their linguistic abilities or different cultural background that they're having. And the first step to implement the language justice is to create some kind of interpersonal relationship between the language worker and the patient to ensure that the patient will open up easily to the language worker and speak their minds by discussing their own problems and issues, and also any kind of complaints that they may have during the visit. Additionally, language justice can also help the patient engage in the decision making of their own health conditions. So finally, I would say that the contribution of the patient in a conversation that is related to his own health condition is very essential in the enhancement and improvement of patient experience. So because patient is going to be able to understand everything's going on within the visit, understand his health conditions and the treatment that he will be taking is very important to give him the satisfaction that they're looking for. And this also can facilitate the provider's job because he will know from the mouth of the patient what's going on exactly with his healthcare, so he can treat them in a very confident way. So basically, the role of language workers is facilitating speech, advocating for the patient rights by making sure that the patient is being treated equally as other people who speak different language, and he's getting the healthcare and that best fits his condition. He also serves as cultural broker and emotional support to the patient, because he ensures that the patient understands that language worker, he's there to help them answer any kind of questions he might have, and understand that all the parts of his healthcare treatment that he might undergo. So if Moroccan hospitals decide to hire language workers or interpreters to interact with indigenous people, their life would be much more easier, and by allowing them to integrate easily in within the community, even though they're speaking different language and they're having a different cultural background than most of the people who lives there. In the last decade, Morocco has taken a very significant steps in the acceptance of the Amazigh people as a part of the community. They started by recognizing their language as an official language of the country and start teaching it to kids from a very early age, as early as the primary school. So they start teaching them the language, culture, and history of the indigenous people. Of course, this will significantly impact the future of these kids because they're going to be able to speak Arabic, French, Spanish, and Amazigh language. And consequently, the life of the indigenous people in Morocco will be much more easier, because they will be able to find people who can understand their language and interact with them easily without facing any difficulties or language barriers. For now, Morocco started hiring people who speak Amazigh language in their government offices. So if you speak the indigenous language, which is Amazigh, and you want it to be seen in the government office, you just need to pick the person who speaks your dialect to serve you and interact with you using your own language. They still don't have the notion of interpreting and translating within the government offices, but finding someone who is from your own culture and speaks your own language would, of course, facilitate the life of the Amazigh in a very positive way. So those important steps that Morocco has taken will make the life of the Amazigh people very easier and help them integrate in the society, make them feel that they are accepted and they are part of the community, despite their different language and despite of their cultural and traditional backgrounds. So finally, their suffering and their struggle has ended by these steps that Morocco has taken. Probably in the future they will think about creating some kind of interpreting services for those people and provide more training for people who are interested to be interpreter for the indigenous people of Morocco. So the last question that I want to answer is, do you believe that these solutions are practical and fair for the Amazigh people? So for now, I think that the result of this solution will be seen in the next few decades from now, until the kids who started learning the language and understanding the indigenous people culture grow up and start having their own career and take a position within the government. But right now, having only a few people who works within the government offices to help the indigenous people get the services that they need is not, I don't think it's enough. It's not enough. They need either to hire more people, because the amount of people they're hiring, it's very limited, or they can just start thinking about having interpreting and translating services for this significant amount of people within their community. So I see that there is some kind of improvement in the acknowledging and the acceptance of the indigenous people, but this improvement, they're going in a very slow pace. We're not gonna see the result in the satisfaction outcome that we're wanted until like 20 or 30 years from now. It's sad that this generation will not be able to see uh, um, that they're accepted and they're um, considered a significant part of the community, despite their different tradition, language, and culture. So they've been struggling and protesting for years to recognize their flag, language, and culture by the other part of the community. And I can say that till this point, all the changes that is happening shows that the future will be better for them, and they will be valued and treated fairly as all kind of people who lives in within that community. At the end of this presentation, I would love to say that we're all humans and we should act as though. Um, Judging group of people just because of the way they're looking, the belief that they're following, or the languages that they're using is never fair to anyone. And being related to a group of people doesn't define who we are. What truly defines us is the action that we're doing and the behavior that we're having to treat other people. Um, the differences should never be an issue that divide our community into different parts and allow them um, to attack each other or turn against each other just because um, one category considered themselves more valuable or more um, um, or accepted than other groups of people. So at the end of this presentation, I would love to say a quote that I have read years ago, many, many years ago. Um, it says that it's not the differences that unite us, it is the similarities that makes us beautiful. So the similarities was never an issue that we should debate about. God created us different so we can complete each other, and the the secret to live in a beautiful life is to accept other people's differences. Thank you so much for watching, and I hope you have a good day.